Understanding trigeminal-mediated headshaking, TMHS. Headshaking in horses presents a multifaceted challenge in equine medicine. It's characterized by a range of behaviors, most notably the vertical flicking of the head, often accompanied by snorting, nose rubbing, and heightened activity of the lips and tongue. While diverse factors can contribute to headshaking, a significant portion of cases fall under the category of TMHS. This specific form of headshaking is understood as a neuropathic pain condition that originates in the trigeminal nerve, the nerve responsible for sensation in the face. One of the complexities of TMHS lies in the fact that in many instances, a clear underlying cause remains elusive. This lack of definitive etiology poses a significant hurdle in effectively managing the condition. The impact of TMHS extends beyond the horse's immediate discomfort, significantly affecting their usability and overall well-being. Handling and riding these horses become precarious tasks due to their unpredictable head movements. Traditional analgesic medications, often the first line of defense against pain, frequently prove inadequate in addressing the neuropathic pain that characterizes TMHS. Existing treatments for TMHS, while diverse, have yielded inconsistent success, further underscoring the need for innovative therapeutic approaches. RTMS, a novel approach to TMHS treatment, repetitive transcranial magnetic stimulation, RTMS, has emerged as a potential breakthrough in addressing TMHS. This non-invasive technique, already established in human medicine for treating various neuropathic pain conditions, holds promise for alleviating the suffering of horses with TMHS. At its core, RTMS operates on the principle of using magnetic pulses to generate electrical currents in precisely targeted regions of the brain. This targeted stimulation is believed to play a role in normalizing neural activity within the affected area, thereby modulating pain perception. Of particular relevance to TMHS, high-frequency RTMS, typically employing stimulation rates between 5 and 20 Hz, has demonstrated encouraging analgesic effects when applied to the motor cortex in human studies. Notably, these effects have been observed in cases of trigeminal neuralgia, a condition with parallels to TMHS in horses. While the precise mechanisms underlying the analgesic action of RTMS are not fully elucidated, several hypotheses have been proposed. One prominent theory suggests that RTMS exerts its influence by modifying cortical excitability and synaptic plasticity. Essentially, RTMS may be retuning the sensitivity and communication pathways within the brain regions involved in pain processing. Another hypothesis points to the role of RTMS in mitigating inflammation. Studies have shown that RTMS can lead to a decrease in the production of pro-inflammatory cytokines, signaling molecules involved in the inflammatory cascade. This reduction in inflammatory mediators may contribute to the observed pain relief. RTMS, a beacon of hope for TMHS management. The potential of RTMS in TMHS management becomes even more compelling when considering its standing against existing therapies. Currently, one of the more commonly employed treatments for TMHS is percutaneous electrical nerve stimulation PENS. While PENS has shown efficacy in a proportion of cases, its limitations are apparent. Studies indicate that roughly 50% of horses respond favorably to the initial PENS treatment, with the median duration of remission hovering around 9.5 weeks. This highlights the transient nature of PENS-induced relief and the need for alternative strategies. RTMS, with its potential for longer-lasting effects and its non-invasive nature, offers a beacon of hope in the landscape of TMHS management. The study we are discussing here delves into the safety, efficacy, and duration of pain reduction achieved through RTMS in a cohort of 17 horses diagnosed with severe, non-seasonal TMHS. These horses, all of whom had endured the debilitating effects of TMHS for a considerable period, underwent a meticulous diagnostic workup to definitively rule out any other potential causes for their head shaking. Detailed study design and outcomes. The RTMS treatment protocol involved daily sessions for 5 consecutive days. To ensure the horse's comfort and cooperation during the procedure, they were sedated using a combination of ditalmidine and butorphanol. The RTMS itself was administered using a circular coil strategically placed on the horse's forehead to target the motor cortex. Each treatment session consisted of 3 sets of 500 stimulations delivered at a frequency of 5 Hz. The researchers employed 2 validated assessment tools, the Horse Grimace Scale, HGS, and the History Rest and Exercise Scale, HRES, to objectively quantify the horse's pain levels and head shaking severity at various points in time. Assessments were conducted before the commencement of treatment baseline, after the 5-day treatment period, and then again at 2 and 4 weeks post-treatment. The findings of this study were particularly encouraging. First and foremost, the researchers determined that RTMS was well tolerated by the horses. While some horses exhibited initial withdrawal reactions upon the commencement of stimulation, these reactions tended to subside with continued exposure to the procedure. Notably, a subset of horses displayed behaviors that suggested they were experiencing a degree of pain relief and relaxation during the RTMS sessions. The most compelling evidence of RTMS's efficacy was the significant reduction in head shaking scores observed in the horses. These improvements were particularly pronounced immediately following the 5-day treatment period, with an average reduction of 70% in exercise scores, highlighting the potential of RTMS to restore these horses' ability to perform. Importantly, these improvements were not fleeting. They persisted for a duration of up to 4 weeks, although some resurgence of head shaking signs was noted in certain horses as time progressed. Two case studies within this cohort stand out as particularly remarkable examples of RTMS's transformative potential. These two horses, both of whom had been retired from riding and competition due to the severity of their head shaking, experienced such a marked improvement in their condition following RTMS that they were able to resume their previous activities. These cases offer a glimmer of hope that RTMS may be able to not merely manage TMHS, but in some instances, provide a level of relief that allows horses to reclaim a life free from the limitations imposed by this debilitating condition. To further underscore the clinical significance of the improvements observed, the researchers calculated effect sizes. The effect sizes, consistently large across various time points and assessment parameters, serve as robust indicators that the observed changes in head shaking severity were not merely statistically significant, but also clinically meaningful. Discussion and future directions. This study provides compelling evidence supporting RTMS as a safe and potentially game-changing treatment modality for TMHS in horses. The observed pain reduction aligns with findings from human studies on trigeminal neuralgia, further reinforcing the validity of this approach. However, the study also acknowledges certain limitations and highlights avenues for future research. One point of consideration is the 5 Hz stimulation rate used in this study. While effective, this rate falls at the lower end of the spectrum of frequencies reported to be effective in human studies. This raises the possibility that employing higher stimulation frequencies could potentially amplify and prolong the analgesic effects observed. Similarly, exploring the impact of longer treatment sessions and a greater number of pulses delivered per session could further refine the RTMS protocol and maximize its therapeutic potential. Another aspect that warrants attention is the variability in individual responses to RTMS. This mirrors observations in human patients undergoing RTMS treatment and underscores the need for personalized treatment approaches. While the study lacked a placebo control group due to ethical considerations and concerns regarding owner compliance, efforts were made to mitigate bias through the use of objective scoring systems and extended observation periods. Future studies, however, would benefit from incorporating placebo controls and blinded assessment protocols to enhance the rigor of their findings. Additionally, the use of standardized video recording protocols for remote assessments would improve the reliability of data collected from horses that cannot be physically re-examined due to geographical constraints. The use of sedation during the RTMS procedure, while necessary to ensure horse comfort and cooperation, introduces a potential confounding factor. Butorphanol, one of the sedatives used, possesses inherent analgesic properties that could have influenced pain perception during the initial days of treatment. This influence, however, is expected to have waned by the time of the later assessments, given the relatively short duration of action of both ditomidine and butorphanol. Nevertheless, future studies could explore the feasibility of delivering RTMS without sedation or using sedative agents with minimal analgesic effects to isolate the effects of RTMS more definitively. Conclusion: a promising future for TMHS management. In conclusion, this study paves the way for a new era in TMHS management. RTMS has emerged as a safe, well-tolerated, and potentially highly effective treatment strategy, offering renewed hope for horses and their owners who have long sought relief from this challenging condition. While further research is necessary to optimize treatment parameters and to elucidate the long-term efficacy of RTMS, the findings presented here represent a significant step forward in the quest for effective TMHS therapies. The potential of RTMS to not only alleviate pain, but to restore horses to a level of functionality that allows them to live fulfilling lives underscores the transformative impact this novel treatment modality could have on equine welfare and the human-animal bond.